Okay, this video is about how will artificial intelligence affect medicine. And, just think about it for 5 seconds. It's an obvious joke. Basically, you know who's going to write it. The big pharmaceutical companies are going to write the artificial intelligence. And what are they going to say? They're going to say, give more drugs. So, of course, it's going to be stupid. It's going to be insignificant. Then the other thing is, well, what about if they start interpreting things? Like they had computers that could kind of interpret EKG, over 10 years ago. Well, the lawyer still wants somebody to sue, so there's still going to be a doctor's name on there, and the doctor's still going to have to check anything the artificial intelligence does. One of the things they might want to do is use them for drugs for more money. Because remember, it's always going to be about money. So if they can lower the cost of the provider, that's one of the reasons why they wanted to replace internal medicine doctors, family practice doctors with nurse practitioners, is because they can pay the nurse practitioner less money, but still keep their money for selling the drug. Okay, that's what medicine's really about. It's about selling drugs. They want doctors to be dealers, not healers. Okay, the other thing about it is artificial intelligence is rigid. It's going to go by a computer code. It can't get the nuance of an interpersonal communication. I mean, one of the things that patients tend to like about doctors is if they can find a doctor that actually talks to them and gives them a little bit of a moment of their time. And an artificial intelligence machine can't do that. They can't handle communication nuance. They tend to move into what I would call a checkbox mentality, whereby you'll see notes like that. For example, look at a medical student note. A medical student will write a history and physical, be 3 pages long, and they don't even know what they're talking about. A really good attending senior physician will write a note 3 sentences long, and it tells you exactly what's going on. And you kind of lose that with this artificial intelligence checkbox mentality. Don't get me wrong, it can sometimes be good to have a checklist, like when writing a pre-procedure note to make sure you get all the right things. Have you checked the patient's medications? Are there any anticoagulants? Check their blood coag labs, that sort of thing. That is useful. Are they allergic to anything relevant to the procedure? Okay, but what I'm basically saying, it just seems to me like one more joke. The simple fact of why medicine, stinks right now is because the people at the top hate the patients, okay? It's run by Big Pharma, just wants to rip off the patients. The insurance companies are in on it too. They want to drive up the cost because they get more money that way. The hospital corporation systems for profit, they want to get more money. And then, what do the patients have? Most of the patients have diseases due to bad diet and exposure to toxins. And no medical surgical bullshitology can fix that. They either fix the diet, avoid the toxins, or they're going to keep on getting sicker. And there's no way around that, okay? And then the medical schools are actually in on it too. Because if you look at all the medical school textbooks and the residency textbooks, they're all written in the same way, where they ignore nutrition, epidemiology, toxicology. I call it a net. Doctors don't know it. Textbooks don't teach this. But that's what makes most people sick. And the whole medical pre-med education, medical education is mostly fake. They learn calculus and physics. That's irrelevant, okay? Like I said, I'm a triple boarded high-tech doctor, and I don't ever use any math I didn't know by 4th grade. All this algebra, calculus stuff, it's a joke. It's just sort of a guild barrier, test, obstacle for getting into med school, but it's irrelevant to med school. Medical school students, you ask them what causes diabetes, hypertension, coronary artery disease, atherosclerosis, gastroesophageal reflux disease. They don't know any of these questions. What's a zeta potential? What's abdominal pressure syndrome? They don't know anything. I've never had a single student answer any of those questions. I've only had one student out of numerous that I've talked to over the last 30 years who knows anything about estrogen, and that's because she was going into OB-GYN, okay? They don't know anything about stress. They know very little about stress management. They need to know sleep and talk more about it. They need time to talk to the patient, have a sense of purpose, why sunshine's valuable, why religion is valuable. They're not even allowed to talk about religion, okay? Social support, all of these things are important. So basically, the stuff that all matters, they either almost never talk about it or don't know it. And all they primarily focus on is drugs, and they don't have enough time to do more. So the bottom line is, I think AI is just going to be a way to sell drugs, and I doubt it's going to do anything good for patients. So